Uh, Good morning.
Yes, attorney.
Uh,
Good morning.
Good morning, Madam Honorable Angelina Tan, the Chairperson of the House Committee on Health, the honorable members of the committee, and the equally honorable and distinguished representatives present right now. To my PhilHealth family in attendance, via Zoom, of course, and the DOH family, headed by our boss, Dr. Doki, fellow uh, participants or resource speakers in this committee hearing today, ladies and gentlemen, a pleasant morning to all of us. Thank you, Madam, for allowing us to clarify the rising issue surrounding the recently released PhilHealth Circular number 2021-0013, entitled the temporary suspension of payment of claims, or what we call the
Attorney
TSP.
Giran, if I may
Yes,
cut you, we will discuss first the UHC implementation status. We'll discuss that issue later on after the UHC discussion. Okay. Yes po. So your statement on the temporary suspension, you can do that later on.
okay, I will yield to the Honorable Chairman.
Okay, thank you. Who will present on the updates of the UHC? May I ask Secretary Duque?
Yes, Madam Chair, I would like you to respectfully request that you recognize USEC Mario Villaverde for the updates on the UHC implementation. Thank you, Madam Chair.
USEC Mario Villaverde, you are now recognized. You have the floor.
Yes, sir. Okay, so Madam Chair, magandang umaga po to the honorable members of the Committee on Health of the House of Representatives, our colleagues in the DOH and PhilHealth, and our partner agencies both in the government and the private sector. Magandang umaga po sa inyo. It is my honor to present to you the status report on the Universal Healthcare Act implementation. This presentation actually takes off from the DOH report during the Joint Congressional Oversight Committee on UHC last year, July 24. But looking back, it was during the 17th Congress that the Universal Healthcare Act was passed into law and eventually signed by President Duterte on February 20, 2019. And immediately after that, Secretary of Health created a task force composed of various technical working groups to craft the different sections, implementing rules and regulations of the different sections of the Universal Healthcare Act. And after so many consultations, public hearings, and focus group discussions, the IRR was eventually signed by Secretary Duque on October 10, 2019. From there, we were able to see the different components of the Universal Healthcare Act, which is shown in this slide. The law gives us a brief explanation of the framework of universal healthcare, and from there it proceeded to more specific sections on the National Health Insurance Program, on the delivery of health services, how we will organize local health systems, and the human resources for health needed, as well as health regulation, governance, and accountability, and other miscellaneous provisions that were stated in the law. Now, to ramp up the implementation of the Universal Healthcare Act in the country, immediately after the promulgation of the implementing rules and regulations, the Department of Health initially engaged 58 LGUs that acceded to become UHC integration sites. In parallel, we started developing 60 operational guidelines and policies that were specified under the Act and its implementing rules and regulations. To date, we are doing capacity building through e-learning modules And we also propose stopping measures to create new units and add additional personnel to implement the Universal Healthcare Act, as well as other health-related laws that were enacted by Congress. Now, we also have aligned our department budget to the needs of the Universal Healthcare Act. So I will explain that these major activities. First, we have the 58 initial UHC integration sites. This constitutes 49% of the total province's highly urbanized cities and independent component cities in the country. They are the first batch of LGUs that have committed to integrate the health systems towards the implementation of the Universal Healthcare Act. The said commitment were formalized by the LGUs through the signed sangguniang resolutions or executive orders expressing the LGU's commitment to integrate their respective health facilities and services. Now, corollary to this, the DOH also has conducted a baseline local health system assessment of each of the UHC integration sites using the local health systems maturity index that we have developed. This maps out the health system characteristics of each of the UHC implementation site, integration sites, and allowing us to tailor fit the approach to ensure integration from the preparatory stage to the organizational and finally to the functional level of managerial, technical, as well as financial integrations as mandated by the law. Now, the second major activity is from the enactment of the UHC Act and the promulgation of the IRR, we have identified 60 critical policies and operational guidelines. These are supplemented by additional guidelines from the PhilHealth, which will be explained later in the next presentation. And these are essential in setting up our province-wide and city-wide health systems as mandated by the Universal Healthcare Act. Now, in the next slide, I will just show you quickly the list of the guidelines that have been issued and published and are now in effect. We have a set of interrelated issuances related to the National Health Insurance Program, which is anchored first on the Consulta package, which will be explained by PhilHealth later, as well as the primary care policy framework and other guidelines on how we will strengthen primary care at the local level. We also have guidelines on the health service delivery, covering both population-based and individual-based health services. We also have another set of interrelated guidelines that cover how local health systems will be organized into province-wide and city-wide health systems, including management tools that our LGUs can use to track their performance and the development of their local health systems. We also covered guidelines on health human resource development for health, including the finalization of the National HRH Master Plan and the guidelines on the deployment through our National Health Workforce Support System, as well as the scholarship and training program. We also have a set of guidelines, operational guidelines on health regulation that will cover safety and quality, affordability, as well as equity in the provision of health goods and services. Also, another set of guidelines that we have developed in the past year are those related to governance and accountability. This include guidelines on health promotion, on our health information system, particularly on how we can strengthen and expand telemedicine or digital health services, particularly in the time of this pandemic. We also have guidelines related to evidence-informed policy development, ethics in public health, as well as health technology assessment, which is now functional. We also have some guidelines on the miscellaneous provisions provided by law. Now, the third major activity that has been started is the capacity building to aid in the operationalization of the Universal Healthcare Act at the local level. The UHC online learning modules were created. It's because we originally planned this to be face-to-face orientation and training courses, but because of the current situation brought about by the pandemic, we shifted to online learning modules. This series of lecture and panel discussions have been crafted to provide an overview of the Universal Healthcare Act and its implementing rules and regulations, as well as the operational guidelines that have been developed so that our LGUs can already start up the integration of local health systems. Now, the next slide will just show you the list of these modules that are now available. At least the first 7 modules are now available in the DOH e-learning module, e-learning platform. No? And we are developing the second phase, which will include human resources for health, the health information system, and so on down the list. No? The fourth major activities that we have done in the last year until this year is the need to reassess our existing functions, our systems, and our procedures, and the organizational structure and staffing of the Department of Health. This is in order to determine the appropriate human resource complement relative to the requirements of the implementation of the Universal Healthcare Act, as well as other pertinent health legislation that were enacted by Congress. We also contextualize this stopping pattern in relation to the redevolution pursuant to the Supreme Court ruling on the Mandanas-Garcia case. No? So we have now submitted this proposal, and the DBM has already approved the creation of some units, but we are still awaiting the approval of certain other units to be created in the Department of Health or in the regional offices. No? So the next major activity is the alignment of the DOH budget for universal healthcare, which has now become the first priority together with the budget for our COVID-19 initiatives. Because these 2 major thrusts of the DOH now, the implementation of the Universal Healthcare Act, as well as our response to COVID, are actually interrelated. And we can see the need to strengthen our primary care, our health promotion, the epidemiology and disease surveillance, as well as health emergency risk management. So these 2 are interrelated, and we included this as the first priority in the consideration of our budget. Now, the immediate ways forward. All of the DOH activities and accomplishments steer the country towards the progressive realization of universal healthcare. However, there are still much work to be done. The DOH will need the help and cooperation of everyone in the health sector as it steers the country towards universal healthcare. DOH, through our regional offices or our CHDs, will always be ready to provide assistance to every LGU that endeavors to integrate their respective province-wide and city-wide health system. Now, amidst the pandemic, the capacity building will continue through our e-learning platforms like the UHC online modules, financing mechanisms for UHC like the Special Health Fund will be institutionalized and made accessible to LGUs for the smooth implementation of the Universal Healthcare Act. All of the UHC integration site will be assisted by the DOH in bringing our local health system at least to the level 1 maturity on the attainment of universal healthcare. So the next slide will just show you some details of our ways forward. The LGU formation of province-wide and city-wide health system is the centerpiece of the Universal Healthcare Act as far as the managerial and technical integration is concerned. And immediately we need to attain a level 1 maturity for all the first provinces and cities that we have included. Now, amidst the pandemic, capacity building will continue through the e-learning platforms. This is geared towards our key implementers, like our regional offices, our local government units, including the provincial health boards and the city health boards, as well as our development management officers in the PIDOHO. Now, to sustain the gains that will be realized from the province-wide and city-wide health system, the Special Health Fund and other UHC financing mechanisms will be established. Towards this end, the process flow, we are now doing the process flow and accountability mechanism for the Special Health Fund, which we intend to finalize within the year by issuing also the joint memorandum circular in relation to the appropriations and the sources of funding for the Special Health Fund. I think this ends my presentation now. Maraming salamat po at mabuhay tayong lahat.
Thank you, Yusek Mario Villaverde. I would like to call on Dr. Shirley Domingo, Vice President from PhilHealth for her presentation. Dr. Shirley.
Thank you and good morning, Congressman Angelina, Chairman of Committee on Health, and good morning all other members, honorable members of the Committee on Health and other honorable members of the House of Congress. I will be giving you the updates of PhilHealth's activities in implementing the Universal Healthcare Act. Next, please. Okay, PhilHealth has been continuously tracking the timely development and implementation of the necessary guidelines to implement the provisions of the Act. Majority of the policies are currently being developed, followed by those that are already being implemented. As you see the pie chart, 50% are ongoing development, while 21% are already being implemented. 7% has governing guidelines, 10% is for approval, 2% with MOA, with the relevant agencies, and 10% to be revised. Our policies, existing policies to be revised so that it is consistent with universal health care. Next, please. So there are 3 types of coverage under the universal health care: the population, the service coverage, and the financial coverage. So as to population coverage, the law states that all Filipinos has to be covered under the National Health Insurance Program. So this is in Section 5, automatic membership. And this is done and been announced to all Filipinos. We also went into a MOA with the Philippine Statistics Authority. It is a joint undertaking on data sharing of death information records so that we can clean out our database of members who has passed away and make our data base more accurate in terms of membership. So the signed MOA was in June 29, 2021. The policy is in effect and the implementation is also in effect. As to the inclusion of non-registered Filipinos in PhilHealth database, because as mentioned, everyone is now a member, we just need them to register so that we put them into our database. So we facilitated registration of all Filipinos and ensure an accurate database using the revised PMRF or the PhilHealth membership registration form. So this is ongoing implementation, and we have a PhilHealth circular on this, the 2020-001, and this started since last year. Another feature of a universal healthcare is the immediate eligibility of members, meaning qualification requirements for them to utilize the PhilHealth benefits was removed under the universal healthcare law. So now it is immediate eligibility. So this is also being implemented since 2019. The guidelines on the granting of immediate eligibility to members has been published and last 2019. And these are on policies and procedures to ensure immediate eligibility of all Filipinos in accessing PhilHealth benefits. Next, please. Also, as to population coverage, the payment of premium contributions. We already published several guidelines on premium contributions. This is in Section 10 of the Act. A premium contribution schedule under this program. The rules and guidelines on the payment mechanism of direct contributors was published in 2020, but this was deferred due to the pandemic. And we are awaiting approval. We understand there are some legislative bills on the amendment of the UHC Act in relation to this. So we are waiting approval of that. Next, please. Similarly, guidelines also on premium contribution for healthcare professionals as direct contributors was published in 2020 and is in effect. However, the premium contribution and collection of payment for overseas Filipino workers, although we already published the guidelines, is on hold, again pending approval of legislative bills on the amendment of the Act. Next, please. Next, please. As to service coverage, next. Okay. Under the Act, there is the primary care benefit, the implementation of primary care benefits under Section 6B, and the mention of a comprehensive outpatient benefit package. Currently, PhilHealth is already implementing some primary care benefit packages, but we are improving or expanding the services of these packages under the Consulta program. So these are improvement of existing primary care benefit packages covering consultations, health screening and assessment, diagnostic services, and necessary medications. Nationwide implementation of Consulta started this year. Early this year, we implemented the Consulta in some selected sites. And now we're opening Consulta to qualified providers for a national implementation, so that areas that are ready for Consulta implementation can already be provided with a Consulta package. So the actual policy came out in 2020. Implementation is this year. Secondly is the guidelines on the registration of Filipinos to a primary care provider. There is already a joint administrative order between the Department of Health and PhilHealth, and this was published in 2020. And it provides general guidelines on the registration of Filipinos to a primary care provider. Next, please. Just a few slides, just 2 slides on Consulta. Next, please. Next. Currently, we have 118 accredited providers, 106 of which is approved, and 12 is on process. As to the number of registered members so far, We have 22,375 members with 7,709 dependents. Therefore, a total of 30,084. Excuse me. Several policy documents has come out on this. Accreditation of facilities, the implementing guidelines, and the governing policy of Consulta was released in 2020. Next, please. Okay, as to contracting of healthcare provider networks, the PhilHealth is supposed to contract with healthcare provider networks, but prior to this, we're supposed to shift to DRGs and come out with global budgets as a background as necessary for us to be able to contract with existing healthcare provider networks. Of course, the organization of healthcare provider networks was mentioned already by the Department of Health. So we're working with them we're working in coordination with them so that we can also implement our contracting. Standards and guidelines in contracting healthcare provider networks in Apex Hospital. So the is ongoing development. And where we hope to finalize such policies in 2022 for initial implementation in 2023. So together with the guidelines are also enhancement of our accreditation standards to ensure quality services. So that's accreditation of healthcare facilities and performance commitments. And also guidelines on incentives and awards to form healthcare provider networks. So all of this is being implemented or prepared together with the Department of Health. Next, please. In the area of ensuring quality services, there are provisions of third-party accreditation and rating system. So this is to provide standards and requirements for third-party accreditation mechanism as a basis for granting incentives to healthcare providers. So there's ongoing development of a third-party mechanism and incentives. And this will also be dependent on formations of third-party offering accreditation services. So we hope to finalize the policy next year and hope to implement it by initial implementation by 2023. Already existing is a benchbook hospital assessment and scoring tools. We have used this to assess quality services provided by our accredited providers. But we are reviewing this, ongoing review of these benchbook standards and hope to finalize the standards by 2020 next year and initial implementation by 2023. As to incentives to healthcare providers, guidelines in providing incentives to healthcare providers that provide better service, quality, efficiency, and equity will be based on PhilHealth rating system. So we are developing a policy and hopefully finalizing it by next year. Next, please. As to financial coverage, one very important provision in the law is that no co-payment or co-insurance policy. This is in section 9. So the title is Governing Policies on No Co-Payment, No Balance Billing for PhilHealth Benefit Package. This is the design and implementation of such arrangements, and a circular was published on this last year. We are still doing succeeding needed circulars for its ongoing and hope to implement a full no co-payment or fixed co-payment by succeeding years. Co-payment and co-insurance, a TWG for co-payment policy was developed on the was organized for the development of such policy. Next, please. Costing and provider payment mechanism. So this is in section 18B, provider payment, wherein we have to shift into a performance-based closed-end provider payment mechanism. So governing policies on PhilHealth costing and costing methodology Circular was published. The guidelines of this was published in 2020, and ongoing development of implementing guidelines for the costing framework and costing manual. As to shifting to diagnosis-related groups or DRG, can you please put up the slide a little? Governing guidelines on the development of benefit packages using DRGs. The policy is for approval, and we hope to be able to implement or come out with the final policy by next year for implementation by 2023. Grouping computation of the global budget and IT standards necessary to implement DRGs is ongoing, and hope to finalize this by 2023, again for implementation by 2024. Next, please. Still on costing and provider payment mechanism, governing guidelines for provider payment mechanism is this year. There is ongoing consultations with stakeholders on this at the moment. As to global budget, governing guidelines for the payment of healthcare provider networks through a global budget mechanism. We're doing the groundwork for this. Several consultative consultations has been done, and we hope to implement this together with the healthcare provider networks contracting 2023, and finally by 2024, the full implementation. Global budget payment mechanism and monitoring and evaluation scheme, again, ongoing consultations and meetings with COA. Policy hopefully will come out by 2023 for implementation in 2024. Next, please. The Special Health Fund, this has been discussed already by the Department of Health. We're part of the TWG that's working on this, so I will pass this. This has been discussed already. Next, please. As to the section 37 on appropriations, guidelines on the operationalization of the 37, guidelines on the remittance and certification, release or transfer and documentary and reporting requirements for the receipt of funds. There's a joint circular for approval by the Department of Health, DBM, PhilHealth, DOF, PAGCOR, BIR, and PCSO. We're hoping to sign or finalize this circular by this year for implementation this year. Next, please. So I think this is my last slide. This is to say that 2024 is a pivotal year for PhilHealth to implement reforms provided by the UHC Act. Network contracting by next year, PhilHealth will be able to provide incentives to healthcare providers to form networks. Therefore, in 2023 and 2024, PhilHealth to contract healthcare provider networks for delivery of individual-based health services. Costing methodologies, as I mentioned, is ongoing. Groundwork has been ongoing. And by 2022, PhilHealth to use DRGs in contracted healthcare providers at Sentinel sites. Review and enhancement of DRG implementation by 2023 so that we move into a full implementation of DRGs by 2024. Again, provider payment mechanisms, the global budgets, we're doing groundwork on this for implementation together with contracting in 2024. The comprehensive outpatient benefit package through an interim program, the Consulta, full rollout by 2022. The difference between Consulta and comprehensive outpatient benefit package is that the COBP includes consultations with specialists, and there are also emergency packages in the comprehensive outpatient benefit package. Therefore, as an interim, the Consulta package is a primary care package. We will hopefully implement, move into COPB and use this in our contracting with the networks by 2024. I think that's my last slide. Next. With that, thank you very much for listening.
Thank you, Doktora Shirley Domingo. Before I call on the first interpellators, I have few questions lang, no? So the one of the primary trust ng UHC is the immediate eligibility. If I may ask, Doktora Shirley, currently based on the projected census of PSA, how many percent of the numbers, that 109 million, are still not covered? Kasi may classification tayo, di ba, for the subsidies of the national government. So based on the data that PSA currently have and your data, ilang percent po ang kailangang i-cover ng national government? Dr. Shirley, naka-mute po kayo.
Ma'am, I think you're asking in relation to the funds being subsidized to us from national government. So how much pa ang dapat magbigay? And how much is
Number
being
of
covered?
Filipinos, Dr. Shirley, based on the latest census in 2020, diba, I mentioned more than 109 Filipinos, and currently you are subsidizing how many numbers of Filipinos? The senior citizens, the one listed in NHTS, the PWDs, the ASKs, and barangay officials. How many?
Ma'am, may I ask our actuary, SVP Neri, to
excuse me.
answer? Oh, yes.
Excuse me, Madam Chair, the
Yes.
short answer there is about 87-88%. So the balance there is the one that's remained uncovered. Thank you.
Okay. And for the budget ng 2022 Sec Duque, yung balance there, did you propose for the funds or funding requirements to, I think, 13%?
Yes, I believe, but let me just check, Madam Chair. I'll get back to you very quickly. I just have to make sure that this is reflected in our budget proposal.
Okay. While
So
waiting, okay, sige, go ahead, Secretary Duque.
So it's 110 billion for 2022. That is the proposed budget required. And the NEP, the National Expenditure Program, reflects an 80 billion budget. So there's a deficit or a difference of about 30 billion, Your Honor. Thank you, Your Honor.
Thank you,
Madam
Secretary.
Chair, with the kind indulgence of the chairperson,
Yes,
relevant
Kong
to kind
Edgar.
understanding. Yes.
Yeah, Kong Edgar,
On
can I
this-
just finish my
Yes.
interpellation, and then we do have list of interpellators, Kong
Ma-
Edgar, if you can list your name.
Madam Chair,
Yes.
just to elaborate on the response of the Secretary with the kind understanding of the Chair, 87%, Madam Chair, of the population of 110 million.
Yes,
That's
it's
to be
currently
specific. That's
87%.
95.
Yes.
That's 95 million of Filipinos covered already. Just for the record, Madam Chair.
Yes, yes.
Thank you so much, Madam Chair.
Thank you, Kong Edgar. So I don't know how can we address that problem, no, Secretary Duque. Siguro during the budget hearing, you can raise that with the members of the Committee on Appropriation. My next question is on immediate eligibility. Currently, because of pandemic, we have a lot of displaced workers. How do you cover the members who are previously covered by their employers, no? Paano ang proseso ninyo once kailangan magpa-hospitalize? PhilHealth. Ang immediate eligibility. PhilHealth. Sir Limwell, Ontalan.
Yeah.
Sir Limwell, hi.
Yes. Hi, good morning po, Madam Chair.
Morning.
Right now, po, as provided by the General Appropriations Act, meron po tayong tinatawag na point of service, financially incapable. So ito po yung wala hong current enrollment. So yung mga pong mga na-displaced po sa workers, they are entitled to NHIP benefits through this enrollment scheme po na na nakasama po dun sa special provisions po ng current GAA and even next year po.
Sir Limwell, if I may ask lang, then who is responsible to pay the unpaid premiums?
Yes po.
Or the national government subsidize the missed contributions of that specific person?
Yes, yes, thank you po, Madam Chair. Dito po sa skema na to, basta po ma-assess ng hospital social worker na ang isang Pilipino po ay kunyari po na-displace o nawala ng trabaho at wala pong kakayahan ng magbayad ng premium. Dito po sa enrollment scheme po na tinatawag natin POSFI, ang requirement lang po dito ay na-assess po ng hospital SWA na wala po silang kakayanan o kaya ho ng LGU na wala pong kakayanan magbayad. Ibig sabihin po nawala ng trabaho at sila po ay na-hospital. Ang national government po later on po ang babayad ng kanilang contribution.
Okay, thank you, Sir Limwell, for explaining that. I think you need to intensify your campaign or information dissemination, especially to our healthcare providers. Kasi that's not what's happening right now. Ang dami na i-refer sa akin na pasyente, na mga displaced workers natin, previously nakabayad, but they are required to pay the missed contributions before magamit yung PhilHealth. So, even yung mga LEO ninyo, ganun ang kanilang ini-implement, ha? So, taliwas doon sa sinasabi ninyo na meron kayong point of service for financially incapable, especially nga our displaced workers. So, kailangang ma-check nyo po yan sana, no? Especially now na kailangan talaga ng ating mga kababayan at wala po silang masandalan. Thank you, Sir Limwell, for clarifying that, no? So isa po yun sana sa inyong tutukan, Sir Limwell.